Welcome to the Cardiovascular Pulse, where we dive into medical breakthroughs, leading technology, and healthy lifestyles. Join us as we empower you on your journey to a healthier and stronger you. Hi, listeners. I am so excited about our guest today, Dr. Shashi Gavini. She is a cardiologist at the Cardiovascular Institute of the South in Baton Rouge and Prairieville. Welcome, Dr. Gavini.
Thank you so much for having me today.
So today we're going to talk about cardiovascular disease in women, but more specifically how it relates to pregnancy and cardiovascular risk. So I guess start out by telling us, why is it important to understand this connection?
Sure. As a female cardiologist, my practice focus is women's cardiovascular health. And we know that for many women, part of that phase in their life during pregnancy is essentially like a stress test on the body, okay? And it's relevant because for the United States, we actually have a staggeringly high rate of maternal mortality, which means adverse outcomes and essentially bad outcomes for mothers during and after pregnancy. And it's unfortunate to see because as a developed nation, you would assume otherwise. And it's interesting because we find studies that show for the first time over the last few decades, when you compare cardiovascular outcomes in general, men compared to women actually do better than they have decades ago. But if you look at kind of the subgroup analysis amongst women of certain ages, so women over 65 now do better than men when it comes to cardiovascular conditions. Women in the age of menopause, so between 55 and 65, their mortality has essentially leveled off. But then if you look at the women younger, so premenopausal women in the age group of between 30 and essentially 50, so those of in childbearing age, you find an actually unfortunate rise in mortality. So we definitely need to take a closer look and understand why. And we think part of that, or a large reason for that, is because of the issues that we're seeing linked to pregnancy and the complications that can happen before, during, and after.
Wow. I think that is a connection that many people don't realize. So as women, what should we be on the lookout for, either before, during, after pregnancy? Maybe tell us a little bit about what to keep an eye on.
Sure. Okay. So in general, pre-pregnancy, if you have cardiovascular risk factors, and by traditional risk factors, we usually mean high blood pressure, high cholesterol. If you're a diabetic, making sure those numbers are well controlled. If you're a smoker, that's certainly a cardiovascular risk factor. Managing a healthy weight. So these would be considered our traditional cardiovascular risk factors to ensure that you see a primary physician, ensure that you're getting regular checkups, and you're essentially optimal going into when considering a pregnancy. Now, many women are very young, don't necessarily have many of these conditions. And so the first time they come with the problem, or the first time they're evaluated, is during pregnancy. And pregnancy is a huge stress on a woman's body. There's a lot of changes that happen. In order to accommodate the pregnancy, your blood volume, so your cardiac outputs, the amount of blood that's circulating, that the heart circulates, almost doubles. It rises by 50% by the end of pregnancy. So as you can imagine, that places an incredible strain on the heart and the body as whole. Your heart rate rises and your blood pressure varies throughout pregnancy. In some women, if they have high blood pressure going into pregnancy because of the fluid changes and the shifts that happen, they can have issues with uncontrolled blood pressures during pregnancy. And some of the changes that happen as far as the swelling, rise, or changes in their blood pressure or their heart rate and shortness of breath, it's really difficult to tell during pregnancy whether something's abnormal, because if you've been pregnant, you know that those are very normal symptoms and signs during pregnancy. But there are certain things that we look for. For example, if you're unable to lay flat or requiring more than 2 or 3 pillows and you're extremely short of breath, that's a red flag. If your resting heart rate is greater than 120 beats a minute when you're during pregnancy, that can also be an abnormal sign. If you're having chest pains or palpitations and those types of things, also red flags that should be evaluated. As far as after pregnancy, depending on the complications that occur during pregnancy, that way we can evaluate what's going on and what we need to be doing.
Wow, okay. So it really helps to understand what to look out for so that we know if we have to see someone or not in regards to our personal symptoms. Why should we be so in tune to our bodies or concerned about our pregnancy history moving forward?
That's a great question. So the reason why, so I talked about, the United States having a very high maternal mortality. And amongst that, Louisiana, unfortunately, has the worst maternal mortality statistics. The reason why it's so important moving forward is we find that women that have had what we call adverse pregnancy outcomes, and that's a term that we use to describe someone who has experienced a preterm birth. So that would mean a child that was delivered prior to 37 weeks, or a child that has had a low birth weight, so less than 5 pounds at birth, or pregnancy loss because she's had complications with these terms called preeclampsia or eclampsia. So those are when women have issues with hypertension that becomes uncontrolled in pregnancy that can affect other organs. So you start losing protein or you start having seizures and those types of complications. And usually when someone's experienced that, they remember these terms that are used to describe the pregnancy. Women that have experienced these complications during pregnancy, a lot of studies show that they have 2 to 4 times higher likelihood later on in life, so post-pregnancy, to develop cardiovascular disease, specifically coronary disease, sooner than the average person. They're also much more likely to have high blood pressure later on in life. So that's why it's very important to know this history and to ensure that a practitioner is aware of this history, even if you're 40, 50 years old, have had children, have had these complications in the past.
Now, does this also tie into family history? So say if my mom had me preterm or something like that, how does that affect it as well?
Sure. So that certainly should be something that is a part of your history and something that we ask about. So let's say you're considering pregnancy. That's important to know if your mother had it. It's not a direct immediate risk factor, but certainly could be what we call a risk enhancer. And there are certain things that we can do if you are high risk for preeclampsia or eclampsia. Things like taking aspirin after the first trimester. These are recommendations that'll come from an OB or what we call a maternal fetal medicine physician that takes care of higher risk pregnancies, or even a cardiologist, And you've seen me mention multiple subspecialties, and that's why it's so important to have sort of a multidisciplinary approach to someone if they've had issues in their pregnancy.
Sure. So it might be more important for someone who is pregnant to see more than their OBGYN, right?
Certainly.
This means consider seeing a cardiologist for some of these more detailed and layered conditions.
Absolutely. I think for someone who has had chronic hypertension, so basically high blood pressure going into pregnancy, especially if you're having difficulty, because remember, not all blood pressure medication is safe during pregnancy. There are specific ones that are safe to use, and usually an OB manages that. But if we're having difficulty transitioning someone, difficulty having healthy blood pressures during pregnancy, then certainly it does prompt someone should see a cardiologist for adjustments in those medications and maybe even doing a deeper dive as to why their blood pressure is difficult to control. Another condition that we should be really aware of outside of your traditional blood pressure issues, so outside of just chronic hypertension in pregnancy, preeclampsia, eclampsia, another thing that we should be really aware of is what we call peripartum cardiomyopathy. It's basically a condition of heart failure that's diagnosed either in the very last month of pregnancy up to 5 months after delivery. So essentially heart failure immediately after pregnancy. And a lot of our studies show that it could be related to hormonal changes that happen that indirectly affect the heart and the way that the muscle squeezes. So it can cause a weak muscle. And so these people's symptoms are going to be really similar to traditional heart failure. Inappropriate swelling, even after delivery, fluid that can accumulate in your lungs, weakness, changes in your blood pressure, and those types of things, and can be very dangerous and can, if it's happened once, then higher likelihood to happen in a subsequent pregnancy and can be very, very dangerous to a mother's life.
So if someone is experiencing preeclampsia or eclampsia during pregnancy or high blood pressure during their pregnancy, what are you going to be looking out for after that childbirth occurs?
Okay. So typically, we're taught that for eclampsia or preeclampsia, the difference between the two is still very high blood pressures. Eclampsia is more severe because those people have seizure-like symptoms, right? We're traditionally taught that delivery of the child is treatment for it. But what we're also finding is that while most people's blood pressures normalize within 48 hours of delivery, that's not always the case, particularly in those people that have had blood pressure issues during pregnancy. I like to sort of think about a pregnancy as 4 trimesters. You have your traditional 3 during the time that you're pregnant, but the 4th trimester is after delivery. Those first few weeks, which are the most important because all the studies show that that is the highest likelihood of complication for the mother, really those first few weeks post-delivery. And what we've seen is that those people that you said that have experienced issues with blood pressures, usually anywhere between 7 and 10 days after delivery, so typically the time that someone is discharged and at home, they tend to have a rebound issue with their blood pressure. So things that people should be on the lookout for is closely continuing to monitor your blood pressure, although it's normalized after delivery when you're at home. Because if you think about it, it's a very vulnerable time for a mother. She's physically recovering, mentally, there's so many things going on. You're sleep deprived. You're caring for a newborn child that's very, very demanding. So just making sure you take the time to take care of yourself, particularly if you've had these issues with blood pressures. So in case there's an issue with rebound, so a higher or uncontrolled blood pressure, even after delivery, that you can be seen promptly, started on medication. So I would say some red flags after delivery, if someone experiences headaches, nausea, vision changes, shortness of breath. This is also a common time that you're very prone to throwing clots. So when you're recovering, maybe not as mobile, especially if you've had a C-section, you're more prone to develop clots in your in your legs, called DVTs, that can travel up to your lungs. A really famous example of this would be Serena Williams. After the delivery of her child, she began to develop shortness of breath, and she was evaluated promptly and was found to have a pulmonary embolism. So it can happen.
And it's just things that you wouldn't think to look out for. Or
Exactly.
While having a newborn, you're not worried about
yourself.
Your vision seeming blurred.
Exactly. So these are certainly red flags and things to be on the lookout for, and that should prompt very quick evaluation.
And this is where loved ones could come in as well and really notice that a mother might be struggling and can say, hey, you might want to see a cardiologist for these things.
Definitely. And I think that's why podcasts like this are really important because, we know these staggering statistics, and part of how you change them is by awareness, by advocacy, by getting involved with local groups like the American Heart Association. I personally am involved with them, as well as an organization called Conscious Moms that support women during pregnancy, after pregnancy, not just from a medical standpoint, but from a physical standpoint, from a psychological standpoint. All of these things are so important in the care of women. And it's not just relevant for women, but, husbands, brothers, fathers, anyone involved that has a woman in their life that they care about. It's important to be aware and sort of guide them through difficult times like this.
Sure. This multidisciplinary care, too, so important to make sure that it's really a full spectrum of care for women. And that's what we want to do here. That's why cardiologists like you are so important, and why we all should really see a cardiologist to better understand our risks, no matter our conditions. Absolutely.
And especially after, let's say, you're postmenopause and you're in your 50s or your 60s. Another important thing I'd like to stress is that every practitioner should be in the habit, especially when you're doing a preventative visit, to ask. I ask every single one of my patients what their obstetrics history is. So how many pregnancies a woman has had. Has she had any of these complications in her prior pregnancies, to even include gestational diabetes, gestational hypertension, eclampsia, preeclampsia. Most times people do recall those terms being used in their pregnancies if they've had that diagnosis. But also another way to ask that would be a preterm birth. A woman usually remembers if a baby came early and why, because we know, again, that person is more likely to develop premature coronary disease. So it is relevant in every phase of life, especially what's happened in the past.
We encourage all of our listeners to see a cardiologist if they feel that they want to learn more about this connection between pregnancy and heart health. So thank you so much for joining us today.
Absolutely. It's been a pleasure.
We hope that this has empowered you on your health journey. If you have health concerns, visit cardio.com to learn more or request an appointment. Make sure to follow this podcast as well as CIS on social media for updates. Thanks for listening.